Today, on Fracture in 5 Minutes, we are going to talk about a type of injury that is considered one of the most complex in orthopedics, acetabular fractures. These fractures are serious and require highly specialized treatment because the acetabulum is the part of the pelvis that forms the socket where the head of the femur fits. In other words, it is the base of the hip joint. When a fracture occurs in this region, we are dealing with a deep joint injury that can completely compromise mobility and lead to chronic pain, the development of osteoarthritis, and in some cases, even the need for a hip replacement in the future. But how do these fractures happen? Acetabular fractures are usually associated with high energy trauma, such as car accidents, falls from great heights, or direct impacts to the hip. In elderly patients, they can also occur after falls from standing height, especially when osteoporosis is present, which makes the bone more fragile. The symptoms are usually quite evident. The patient experiences intense pain in the hip or buttock region, difficulty or total inability to bear weight on the affected limb, and extensive bruising. In some cases, there may be injury to the sciatic nerve, causing radiating pain or sensory changes in the leg. In more severe situations, the hip may even come out of place, which we call a hip dislocation associated with the fracture. Diagnosis is initially made with a pelvic X-ray and confirmed with computed tomography, which allows precise visualization of the fracture lines and helps guide treatment. So how is it treated? This depends on the type of fracture and the patient's profile. In non-displaced or stable fractures, especially in elderly patients or when the fragments do not compromise the joint surface, treatment may be conservative with rest and progressive physical therapy. In displaced fractures, or those that directly affect the joint, most cases require surgery with reduction and internal fixation. The goal of surgery is to reconstruct the anatomy of the acetabulum using plates and screws, restoring the normal shape of the joint and reducing the risk of future osteoarthritis. This is a complex procedure that can be performed through an anterior or posterior approach to the pelvis, depending on the fracture pattern, and it always requires detailed preoperative planning based on the CT scan. In elderly patients who already have advanced osteoarthritis before the fracture, in some cases, the best option is the direct placement of a hip prosthesis, with or without reinforcement of the fractured acetabulum, aiming for faster and less painful functional recovery. After surgery, rehabilitation is a fundamental part of treatment. The patient may need a period of controlled weight bearing, the use of a walker or wheelchair in the first weeks, and a progressive physical therapy program. At UPhysio, we have a complete rehabilitation protocol for acetabular fractures, with exercises organized in phases, from bed-based activity to the recovery of walking and functional independence. If you or someone close to you is being treated for an acetabular fracture, schedule an evaluation with me or a member of my team. The link is in the description, along with access to the UPhysio platform. This was the explanation about acetabular fractures here on Fracture in 5 Minutes. In the next episode, we will talk about femoral neck fractures in the elderly, one of the main causes of loss of functional independence after falls. Like, share, and subscribe to the channel. Here, you understand orthopedics with clarity, technique, and responsibility.